It is so important to keep you safe and well. Here at Living Well, Danielle and I take your health and COVID safety seriously. With opening our borders here in South Australia, we need to be sure we are following the mask guidelines. With every consult, we will be documenting what personal protection both you and I, as well as Danielle, have been wearing. So that's masks for you, masks and eye protection for me, and that may even include a gown and gloves, depending on whether I'm examining you or not, and COVID's vaccination status. So there's some variables, but I'm on to it. We will also document any errors or breaches, as in if the mask is not being worn properly or something's been forgotten or not done. And we do this so we know exactly what action needs to be taken should it be found out that someone has become COVID positive, whether that's staff here or people that come in here. And it's so important to know, because then that will determine whether someone needs to isolate or not, possibly, and how long they isolate. So not wearing our mask properly increases the likelihood of obviously not only catching coronavirus and transmitting it, but we also might have to isolate or isolate longer if it hasn't been worn properly at all times. Now, some people may think that this is inconvenient, and I hear you. But we feel that here at Living Well, getting COVID or having to isolate would be far more inconvenient than wearing a mask properly. And that's why we do it so diligently here. Some may even ask, does a mask even really make a difference? But if you know me, I'm relentless. And when it comes to best evidence and care, I dive into it and I look, is it worthwhile? Is it effective? And how effective? And I have to come back unequivocally, yes, without a doubt, masks make a major difference. So what am I talking about? I'm talking about ideally a surgical mask if you can get it. Putting it up over your nose, around your ears, pinch it if you've got the little wire in there, form it along your cheeks, give it a little tuck so it's underneath, and look, it's not coming off. I can move, I can dance, it's not coming off. I do not have to touch my face again. I want you now to take this time to have a serious look at the masks that you have. I want you to look at how they fit. Does it stay above the nose? Because every time it comes below the nose, I document it. And you know why? Because it's for your safety, and as well as the safety of every other patient I come in here, and I'm documenting everybody else's for your safety as well. Make sure it stays on. It's easy to put on, and it stays on, and I don't have to adjust it. I put this on and I can wear it for hours and I don't ever have to adjust it. So have a good look at your mask, find what stays in place that you don't have to touch again, and you are now ready for your next consult and minimizing your risk of COVID. Keep safe, keep well.